Hello, Jokers. Thanks for watching this episode of Jokers Physiotherapy. So, today, the talk is about jaw arthritis, tonsillitis, psoriasis, psoriatic arthritis. Well, they're a bit of a mouthful. What are they? So, you may ask, jaw arthritis and psoriasis. Now, the psoriasis is a condition, autoimmune condition, so your own immune system is attacking your own body. And in this case of psoriasis, it actually inflames your skin. So the most common part is usually around the elbow, this area where it gets really red and the skin becomes really dry and flaky. So if you just brush, you may see some flake of skin just falling off or float in the air, kind of thing. And that is it is a common condition, often very similar to dermatitis, but it is a particular type called psoriasis. And also jaw arthritis and psoriatic arthritis. So I see people who come in here, obviously I meet them for their own needs in their jaw issues. And often they either have psoriasis obviously when I ask questions about any other medical conditions, they will mention psoriasis or psoriatic arthritis. And psoriasis, from the statistics, they say about 17% of people with psoriasis may develop psoriatic arthritis, where the psoriasis also affects inside the joint, such as the jaw. So that's where both are autoimmune conditions, psoriasis or psoriatic arthritis. And I see people who just have or have diagnosis of psoriasis or psoriasis as well as psoriatic arthritis, or no psoriasis diagnosis but psoriatic arthritis like conditions. They see me for their jaw problem for the first time, either having been treated for their psoriasis or psoriatic arthritis. Somehow there's very strong link that affects their jaw joint. Obviously, in the case of psoriasis, it is quite common. Psoriatic arthritis, it is common in the neck, but obviously can be quite common in the jaw joint. Now, in the case of psoriatic arthritis, obviously the cartilage inside the jaw joint are obviously eroding or becoming more inflamed, and it's easily chipped away. And that over time, since the jaw is one of the most used joint in our body, you could be chewing 3 meals, each meal 30 minutes, 3 meals, about hour and a half each meal. You may be biting, chewing 2,000 times. So in 3 meals, you may be chewing 6,000 times. Plus, as I am doing now, you are talking, using your jaw joint. And if you are in a profession where you talk a lot, like teachers or like myself, physio, talking to clients and patients, it could be maybe 10 hours every day. So you could imagine that if you are doing that with the condition of a psoriatic arthritis, it could actually trigger what we call an osteoarthritis in the jaw joint, which is like a cartilage wear down, and eventually can become a bone and bone situation within the jaw joint, like any other osteoarthritic conditions. And I've realized over the years on further questioning these clients, because the reason why I got to this is because I ask, as part of their clenching symptom or grinding symptom, which often jaw joint or jokers have, not everyone, but many of them have, is they're clenching, grinding. And that could be to do with the mouth breathing pattern where it dries their mouth. And because the reason for their mouth breathing pattern is often to do with a sinus problem. So I asked them about the sinus problem, and they say, no, I don't have any issues now, but I used to have lots of sinus problem. And often it was to do with a tonsillitis. And often when they were young, they were getting a repetitive tonsillitis, and it obviously was challenging the immune system at that time, obviously causing infection and inflammation around the throat. So this is all incidental findings, and I have obviously yet to do extensive research into looking up into like some sort of research evidence, but I'm sure there will be some level of link between these conditions. So it doesn't have to be tonsillitis, but if you are getting repetitive cold episodes or conditions that challenges your immune system chronically, repetitively over time, it can trigger stress to the immune system, which may be expressed as psoriasis first, which can develop or progress, however, away to become psoriatic arthritis. And also as I mentioned, as I've shown you here, obviously other high stress events, which may be more of an acute stressful situations. It can, really, really overload your immune system. So these are the things I see. I'm not saying they're all totally linking each other, but I see this pattern. So obviously looking after yourself, controlling the stress level, they're all very helpful if you are yet getting any issues with psoriasis, psoriatic arthritis, or obviously jaw problem. But if you are the ones who are putting up with any jaw issues, that may be to do with the jaw, stiff joints in the jaw, tight muscles because of that, physios can help, like any other conditions around your body and the joints, by improving the stretch gently. Obviously, if you stretch it too aggressively, it can irritate the jaw joint or capsules or ligaments, so it needs to be in a measured way. There are certain techniques to improve the stretches, which I have done as videos in the past. So they are really helpful. Please check my channel if you like, and I'll make sure they are linked in the comments below, in the descriptions below, and to also release the tight muscles. Also, if the jaw joint is so inflamed and it is so painful, it is also important that considering that the 50% of the jaw joint is made up of the skull. So if the skull obviously is to do with the posture, so improving the function of surrounding structures such as the neck, as in the posture, strengthening the muscles that improve the posture, such as the back muscles around the shoulder blades, back of the neck muscles. For you to have a good posture overall, especially while sitting, you need to actually have a really good strength in your abdominal muscles. And then if you want the good, strong abdominal muscles, you also want to match that up with a good gluteal muscles, which is the buttock muscles. Obviously, they're not used in sitting, but it is helpful if you are standing and looking down, like if you're a chef, looking down, chopping things, cooking things for a long period of time, every day, for months and years. Yeah, so jaw may be just a symptom where it is the victim of other areas not working really well. So improving those areas can definitely help contribute to improving the health of your jaw joint. Let me know how you feel. and what you think about this video. I'd really appreciate your feedback or any comments. And if you like this video, please subscribe so that you'll be notified of the future videos like this. So, thanks for watching this episode of Joker's Physiotherapy, and happy rehab. Cheers!